Live now on okay, so we're on Facebook now. We should be live on LinkedIn as well, live on YouTube. Twitter's also good, and we should be on Twitch as well now. And just checking that we're also on Instagram. Hey guys, everyone checking in over on Facebook, LinkedIn. Yeah.
What up, Twitch?
Twitter as well. Awesome.
What up, Twitter
Great.
guys?
Everyone's all on here. So, hey guys, welcome to the CPD Junkie podcast, #lockdown special, where every night at 8 p.m. we bring you interviews with the dentists sharing their CPD stories and journeys from around Australia. What better way to learn than to follow those who've already done it before? CPD Junkie is Australia's most comprehensive CPD, so head over to cpdjunkie.com.au and become a member for free to access the full features of the site. I'm your host, Laurence Doan, and today we are joined by Dr. James Tran. JT, as his patients call him. He worked in Cairns for a number of years before moving back to New South Wales to be with family. He's an associate dentist in the Central Coast during the week and in Sydney on weekends. He is also currently a clinical tutor at CSU. Previously a computer science. James switched careers and graduated from USyd in 2014. He's currently going through his orthodontic training and has just started on his implant learning journey. Dr. James Tran, welcome to the show.
Oh, thank you for the introduction. Thank you, Lawrence.
So, you graduated from USyd, moved to Cairns to work before moving back to Sydney to be with your family. Why the initial move?
Oh, well, when you finish dental school and leading up to it, I was just so stressed and I knew I wanted a big holiday. And so I just took 3 months off, and when I came back to Australia in February, all the jobs are gone. They were all gone. And which was just really a pain in the ass. And I had to pretty much look for the really crappy jobs and apply for those ones. And I ended up calling up a place in Cairns, and the guy was like, well, we really need someone. Come up here, we'll give you mentorship, da-da-da. And so, okay, I flew up and I checked it out. And that's how I started. I just took the job. There was really nothing else out there for me. So it was more of I had to take what I could get kind of thing.
So, what would you say to all the, up and coming dentists or graduates that's going to happen now? What would you say now?
I would say start looking earlier and find a job probably now if you're in your final years, and try and get something in the bag, and start building a portfolio. Take some photos of your cases, take some notes, and build a little PDF, a little Word document that you can put in your CV to impress your future employers. If you want to take a big holiday, just a week or two, but don't do a 3-month thing like me, unless you want to do a whole year or whatever you want to do. But that's what I would do if I had to go back in time and could do things again.
Yeah. Well, I guess some of these things we can never predict, like COVID, hey?
That's it.
So, I don't know if you were always, but as far as I'm aware, you've become a pretty hardcore serial CPD junkie. You're undergoing your orthodontic training at the moment, but also starting your implant learning as well. Tell us about this balancing act that you've got going, and ultimately the journey to what led to this point.
Okay, yeah, so I am doing quite a bit of CPD in recent years. And I suppose when I came back to Sydney, before I came back to Sydney, I was just doing bread and butter dentistry, just fillings, the occasional single crown, no ortho, no implants. It was busy enough in rural Australia to be happy, I guess, in my work and life. And when I had to come back to Sydney, I talked to my friends. They all say it's highly competitive. You got to learn these other skills so that you can provide better treatment. So that's how it all started. And I guess the big thing was, should I start with ortho or should I start with implants? I really didn't know. I did the Lincoln Harris Continuum at the time, which is a 1-year course. And that kind of taught about a lot of, by the end of it, you learn about full mouth rehab and how to approach it. And then I just chose ortho for whatever reason, because talking to implant guys, they do a lot of implants, but they don't really do much ortho, whereas a lot of ortho people can progress to implants, or they can move teeth around to where they like to put an implant in wherever they want without having to mold around too much. That's just how I chose it. You could do implant versus ortho, then ortho versus implant, but that's how I went about it. So I started my ortho journey, did that, started that about 3 years ago, and I think I know enough to start some basic cases. So, and I think now slowly, I'm still learning ortho, but now I think, okay, I can start learning some implants and put that as part of treatment planning and offer that to my patients.
Yeah, so I mean, you're only brushing on it lightly, but you did a lot of ortho, not just one type of residency. You did like a few different ones, right?
Yeah. I suppose ortho is a really, I guess, contentious area of dentistry, as many out there know. And it's just because there's a few dentists who, I guess, go in there pretty cowboy and end up with a bad outcome. And so what I wanted was, I just wanted a university-based course behind my back first. So I did the University of Sydney long course for a year. So that was a bit of hands-on, 1 day a month on average. And you do a half day of hands-on, seeing patients. You're actually putting brackets on and changing wires, but you only get to see class 1 patients. Where in the other half of the day, you do didactic. So you learn, they try to teach you as much as they can in a year over, 12 sessions. And, after that, it was, okay, I really don't know much about ortho. There's so much more. It was nice to get the hands on, but I still couldn't recognize pitfalls. And so, I then I wanted to do, everyone was saying, oh, do airway, because that was all the rage. So I picked the IA Dent orthopedics course. So that was another year. Finished that, and still I felt it wasn't enough for me. It was great to learn about early interception, which I know now, but I still didn't know much about didn't know much about Invisalign. So I signed up for the EODO residency, which I'm doing right now in my second year. That's a lot of fixed ortho. And so that's my journey thus far. I'm also just doing odds bits and pieces in terms of clear aligners and Invisalign, because that's the future. Like a lot of people who you offer to ortho to, they will say, I want Invisalign, I want clear aligners. There's not many people nowadays who want to get fixed, even though it gives you a better result end-wise. So that's my current journey. I am looking into, in the future, maybe doing, not immediately, but maybe in a few years, maybe doing a master's with the University of London. There's a master's of clear aligners, or maybe the EODO clear aligner course, but we'll see how it goes.
Yeah. Would you say that you would have to know some fundamentals in terms of the fixed conventional route before dabbling into the aligners, or would you say you would be comfortable recommending just go for aligners before going down that other route?
I mean, if you go straight into aligners, you can do that, but you'll have to do at least some courses on diagnosis, skeletal diagnosis, dental diagnosis, overall facial, maybe a little bit airway as well, and then recognize also, can this be done with aligners? Most cases can be done with aligners. There are some which will be a bit tricky. I'm seeing some cases where I'm not doing myself, but I'm seeing other people doing mixed hybrid, so a bit of fixed to get a lot of that hard rotations or hard movements out of the way. And then when you're done with that, then you can put them on Invisalign or clear aligners, and it's just much more easier than try and get the clear aligners to do the whole job. So I haven't found any courses that does it all. So you really should learn at least foundational diagnosis, maybe a little bit of fixed. That would help, because once you get to some clear aligners, you want to just do some refinements, and it's not enough doing the clear aligners. You might want to put some brackets on just to close up some spaces or whatever. And so that learning that skill would really help you, I would feel.
Fair enough. And then, so how's your implant journey going at the moment?
Oh, I just started this year. So I had a little taste actually about a year to 2 years ago, just like a little weekend course. And this was with, they flew someone in from the States and they had cadavers, actual cadavers at the Sydney Eye Hospital. And
Yes.
you'd go in and you do a bit of theory, and then the rest of the day for the second day, you'd actually put some implants in cadavers, which is the next best thing to drilling into a human, right? So I felt, oh yeah, that was nice. And then when I was just doing the hands-on, oh, this is nice, but I'm just putting implants. Putting the implants in the bone was pretty simple. It was just a theory that I realized I needed to know. So, but I didn't have time to, and I didn't have money at the time to sign up for an implant course. So this year I signed up for 2 courses, the AIA course, which is the Australian Implant Academy, and I will be starting the Chris Ho grad diploma, I think. That will be starting next month. I guess with the Chris Ho, I wanted the letters and I wanted that nice theory. They've got some bit of mentorship in that program. AIA's also got some mentorship, but it's really got that hands-on, there's theory and there's also actual live hands-on at the moment in Australia. So you go in, actually treat patients under supervision from the mentors there. So it's kind of I wanted a best of both worlds, of didactic and a bit of hands-on. So that's where I'm at right now.
Right. So, I mean, apart from the implants and ortho as well, you've done some other stuff as well, haven't you?
Yes.
I mean, you've done, is it some wax ups, some Cerix as well?
Yeah. I did Sahil's, rubber dam course, and then he offered the wax up course, so I did that one as well. I found more value in the rubber dam. With the wax up, after that course, I probably did like 1 wax up myself at home, and then I was like, oh, I'm done. It's not for me. So I've just been sending my jobs to the lab. So
took up too much time, hey?
Yeah. I just don't have time, but it's nice to know. I still got like my lab kit. I can do a wax up at home if I wanted to. It's nice. It's a nice skill to have. Yes, Lincoln Harris I've done. Recently I did the DSD one residency.
Yeah, that's 13 weeks, isn't it?
That's like a 13-week weekly course.
Yeah.
That was good.
Interesting, we were talking about ortho for a second ago. Did you do a sleep study on yourself?
I did. Yes, I did. I was.
What was that like?
Oh, I was at ADX, like not the last one, the one before, and I had to sit in the front row. I was a bit late when Derek Mahoney was talking about sleep apnea. I didn't know much about it, and then he was right in front of. I was sitting right in front of him. He was going, half of this room has sleep apnea. All of you should get a sleep study. And he was spitting. It was all over my face. I thought, oh, okay, I'm going to get a sleep study. And I thought, oh yeah, I do snore. I do have restless sleep. So I got a sleep study, and yeah, I was moderate sleep apnea. So that was my diagnosis, which got me on my journey. That really inspired me to learn more, I suppose, airway-based orthodontics, not, I wouldn't say airway-centric, but, orthodontics that encompasses airway as part of its curriculum, as part of your diagnosis. Yeah.
Yeah. So, I mean, then you could relate to the patients and what they're going to experience.
Oh, yeah, for sure. Yeah. Talking about the CPAP, talking about possible surgery, and they go, oh, they look at me and go, oh, you got sleep apnea? Like, an old 52-year-old going, oh, you got sleep apnea as well? Like, you're not fat. Like, but I've got it, yeah. So it's surprising how many people do have it when you ask the right questions. And you send them off and they'll come back and go, oh yeah, I sleep better now. Or you send a child away who has sleep apnea. They come back and they get the tonsils or adenoids out or whatever's causing sleep apnea, and then dads are really grateful when you see the change, see the growth after they've had treatment done. They perform better at school. They're much more lively. They're less they're less rowdy. You know, it's really
Yeah.
it's
Have
really
you found
rewarding.
that difference with yourself?
Myself, not really. I'm on the sleep. I sleep better, a little
Yeah.
bit better, I suppose.
Yeah.
But I really hate the machine. I just want to go. I need to book in and get some surgery. And I'll probably have to advance my maxilla, but I'll have to see an ENT and get that done. You know, get scoped and really get something done permanently. I'm not a really good patient when it comes to CPAP. I'll admit that. Yeah.
It's all good, it's all good. Safe space, safe space.
Safe space,
So
safe space.
let's come back to this DSD thing here. So, I mean, you bought your own Trios scanner. I mean, that's equivalent to buying a second-hand car. You know, it's something that most recent graduates probably can't fathom. You know, what are your thoughts on associates getting gear that they want themselves?
Yeah. I don't know. When I did the course, you know, that was already an investment, like almost 4 or 5K at the time, whatever it was, and just going through the course, I was just thinking, oh, I'll learn about smile design. Da da da. It was more than that. It's more like a communications course on how to work with digital technology. And by the end of it, I just thought, like one practice had a scanner, but it wasn't a Trios. It was just an old Omnicam, and it wasn't good enough for my workflow. And the other practice didn't have a scanner yet, so I thought I really want to get a scanner. So I got that Trios. You know, it wasn't cheap. Obviously, had to get a loan for it. But already since I got it, I got it in October last year, and I've started a lot more Invisalign cases, getting a lot more conversion. You know, people are wowed by the whole experience. It's really, for me, I found it really useful. But it's only useful if you know how to use it and you present the plan and you know how to do that treatment that you present. So if you're a new grad, I probably wouldn't go so much as buying a 50K Trios or something like that, iTerra for yourself. Maybe like the Medit i500, like a secondhand one. You don't need the i700. i500 would be fine. Just do basic scans. You can send that off to the lab and show the patient what you see in their mouth. Combined with photography as well, because the scanners still aren't as good in terms of photo quality. If you want to show someone a crack, you still need to get that camera out, DSLR or mobile phone or whatever, so you can show that detail. So in terms of getting equipment as a new grad, I'd say go for it. Start with a camera, and then save up for a cheap secondhand scanner would be the next step if your practice doesn't have one already. That's what I'd be doing.
Did your chemical science past have anything to do with this digital dentistry interest?
Computer science, yes.
Computer science, sorry. Computer science.
It's all good. Yes. Well, I dealt with computers. That was my undergrad, and I worked a few years in IT and dealing with anything computers, software, and all that hardware. It just made me easier it was just easier for me to pick up new technologies, really. It doesn't mean if you haven't had a computer degree, you can't learn the technology. You can learn it. It's really easy now these days. Unless you want to try ExoCAD or something like that, it's a bit more technical. But for basic technical things, I think you guys would be fine. For the new grads, don't stress too much. You don't need a computer science degree to do what you want to do in dentistry. It's not really an advantage, I'd say. The only thing really is when people at work find out that I did computer science and the printer breaks down at work, I hear a big yell going, "James, fix the printer! Help us out here!" That's really, it's kind of a disadvantage actually, so don't tell anybody.
They're not watching. They're not watching.
They're not watching.
So, of all those CPDs, what led to the biggest clinical impact, you would just say, on your dentistry today?
Oh, it depends where you are in your dental journey. I'm 7 years out, and that DSD course I did last year, that was the biggest one so far, because it made me buy a scanner, and it's helped me produce more complex treatment plans and produce a bit more. But if I bought that scanner in first year, I wouldn't be able to I could probably scan and present, but I wouldn't know how to communicate that to my patients. So, as a new grad, the best course for me was a communication course. That was the, who's that guy? The relaxed dentist, the real chill guy. The relaxed
Mark
dentist.
Hassard.
Mark Hassard, yeah. So I did that. That was my first big course, like at the time, $1.50 for 2 days. I was just, this is so expensive and blah, blah, blah. And then, I made my money back within a few weeks. Instead of having extractions, I was doing more root canals. And then, of course, from root canals, you do crowns afterwards, right? So for me at that time, that was the best course as a new grad. And then now I'm converting more people. I can communicate. I learned more about, more fixed works, more so the Lincoln Harris course, that was really good for me at the time because I wasn't doing very good dentistry beforehand. And after Lincoln Harris, I could identify where I was going wrong. I could fix and correct myself along the way. So it just depends where you're on your journey. So each of those courses were kind of a turning point for my career, clinically anyway.
Yeah, fair enough. So you're saying that with Lincoln Harris, it was better because you had a few years under your belt. Then you could review back and look at how you needed to improve, and then also take it from single cases to full mouth cases. Definitely,
for sure. Yeah. So, Lincoln he really makes you work hard, and he's quite a serious critic of your work, and it just forces you to reflect and one of the things he encouraged all of us at the time to do is to post your work on social media. So that got me to start my little Instagram, just posting work out there. And the thing is, when you're going to post work, it makes you go a bit better, a bit more refined. You know what I mean? It makes you do better work because you have to show it to the public. It's kind of odd, right? When you should be doing it naturally, but I felt that was really good as well in terms of my learning. Yeah.
Fair enough. So, you might have dabbled in it already, but who would you say your biggest mentors or idols or inspirations in your career path and why?
Oh, obviously Lincoln. Obvious reasons. Besides Link, a lot of, I guess at the moment, just on Instagram, a lot of, following a lot of people there. Some of the oral surgeries, Dean Leichenblatt, he does the AIA, he does a lot of implant work, watching some of his work on Instagram. My current boss at Central Coast, Ned Restrom, he does a lot of implants as well. In terms of, I guess, orthodontics, I don't have many people to bounce ideas off, so I use a lot of the services that are given in the orthodontic courses. So IADent and EAD have like after hours or like study clubs or orthodontists you can contact and bounce ideas off. So I talk to them about cases and that really helps, I suppose. But at the moment, just Instagram, really. I'll be honest.
That's okay. It is what it is, and we're of that social media day and age right now. So naturally, that's where all our attention is at the moment. So, would there be any particular struggles that our viewers might not be aware of throughout your CPD journey and dental journey?
Yeah, I suppose when I first came back to Sydney, I hadn't started the link course, and I was just doing really, I suppose at the time, just quite rushed dentistry. Just trying to build, and it kind of got me in trouble to the point where I was actually let go at a practice for being not really communicative enough in terms of treatment planning and explaining things to the patient. So what I did was I did a single visit root canal with a crown on a 1-1, which had fractured at the gum. So it's kind of a bit of a periodontic job. There wasn't much for all, if not at all. And the whole thing broke in about a week or two. And it was like, oh, okay. And from a business perspective, I was let go because even the patient wasn't too alarmed. It was me not explaining everything, not explaining the risks, not knowing the risks I was just happily just doing root canals and crowns, you know. And since then, that really was at my kind of, that was my kind of my low point in my journey. And kind of it got me to, I guess, okay, I got to do CPD. I got to step myself up, step my game up. Doing all these CPD, it's really slowed me down in terms of dentistry. I was quite quick before, seeing, you know, 10, 20 patients a day. Now I'm seeing, you know, much less, probably up to 10 a day, if that. And I'm really making sure things are explained properly to patients. Patients are happy, they know what's expected, doing the right things clinically, you know, not taking any shortcuts. So that's kind of, you know, if you know what I mean. If you haven't been there, you might be there, or you might be there now. It's not the end of the world. You can always pick yourself up and go from there.
Yeah, thanks for sharing that. I mean, would you say that, you know, in the lead up to that point, you were just losing passion? There wasn't any like drive. Did you feel like you were burning out? Are these a combination of factors that were kind of leading up to that point, or it was just a matter of you just didn't know? And I mean,
yeah, kind of a bit of both. Yeah, more like I didn't know. You know, at the time. Yeah, I was kind of get burning out. Okay, I'm just doing single dentistry. I'm seeing people doing implants, ortho, all these big jobs. I don't think I'll ever be that. I don't know where to start in that journey, you know. And so that's where I came from at the time. And when I was let go, I felt the biggest weight lift off my shoulders for some reason. I just felt like, wow, okay, that was a big stress that I did not know I had. And it went off my shoulder. I felt my mind clear. I didn't even know it was foggy at the time. And so that was a big moment for me, just relaxing and then from there, I was like, okay, I'll do things properly. And it's been I'm slowly getting better since then, you know? Yeah.
Well, I mean, like we said, we're also early in our journeys, aren't we? It's a very long career, and, you know, it's important that we learn. I mean, you're reflecting on it, and obviously, like you're saying, it's helped you progress. You know, it hasn't compelled you to dig deep, as in like go into another state of continual burnout. You know,
That's
and it's
right,
great that it's put you on a trajectory. You feel like you're becoming a bit more passionate and a bit more passionate about how you're approaching things. So what would you say your current ideal clinical day looks like? You know, the types of procedures you might be getting up to.
Oh, I suppose, well, ideally, you know, working 2-3 days a week, walking in, and just have a lot of big work in the morning, and, you know, maybe an implant, and then maybe some orthodontic treatment middle of the day. You know, I guess some smile designs, bit of consults in the afternoon. Just a lot of chatting. I really like to end of the day with the low energy appointments, like consults, even some cleans or crown cementations, just real chill, because in the morning, that's when I'm most fresh. I want to get all that energy. That's when I'm peaking, so I want to do all that stuff out of the way, and then lunchtime I'm tired. Just want to relax and just chill and just chat. My DAs know I love chatting, and they're sick of me chatting, but I just chat. I just love to chat. So that's my ideal kind of day. You know, and it's not just what I want. It's also what the team wants as well. They want a nice, relaxed end of the day as well. They can clean up and finish on time. And, you know, I would love to have, you know, when I walk in, crowns are in there. I don't have to ask the DAs to run around and all this, and all the equipment's all stocked up. That's a dream that we'll get there eventually.
Time. Once you build those systems in, hey?
Once you get the systems, yep.
Yeah, so share with us what you hope your clinical and non-clinical ideal day might look like in 5 years' time, and what kind of CPD. I think you already mentioned a few of that CPD, but, you know, are there other CPD that you might be interested in getting into? I mean, you've already named a few, but...
So with the... With my clinical day, yes, that's pretty much what I want to have, you know, that busy in the morning and chill in the afternoon. In terms of CPD...
Or even non-clinical side of things.
You know, I want to do the Aniko ball, posture, posture course, a Nico Ball's posture course 2-day, just to really, how to sit properly, how to, because I get a lot of back pain and neck pain. Even though I'm using a Pentax right now, I still get some aches here and there, so I would love to do her course. That's like a half clinical course, I suppose. I would love to do the COIS residency introduction. That's like that 1 week, whole thing in Seattle or US, where it is.
Yes, Seattle.
Seattle, yeah. There's a guy in South America does a lot of cosmetic aesthetic work. I can't remember his name, but Newton Fal, and I'd love to do his course on anterior composite work. Maybe long term do a perio course with Otto Zur, I think that's his name. But that's years away. I'm not at that level yet, but it'll be nice. It'll be nice to do something like that.
Well, let's backtrack this a second bit. You mentioned Pentax, you mentioned back. You're so young. You're only 7 years into your degree, and you're talking about. Let's talk about that. Did it come about because of something, or?
Well, it's been long standing since my IT days. So I used to slouch over the computer all the time. Really bad posture, and I developed back arthritis in my mid-20s, and then
mid-20s, is that you're in the middle of your dental, like in the middle of graduating and in your undergrad, or? Yeah,
pretty much. I graduated at 30, so I'm late 30s now. But like, I suppose, so it's been 10 years since I first really did my back in, and I left IT and then to join dentistry and break my back even more, leaning over and seeing patients, not very fun. And since getting the Pentax, it's just forced me to sit up. It's been really good, actually. I used to go home just tired and foggy brained and not be able to talk to my wife or my family, mum, dad, just want to sleep and rest. But now when I go home, I can actually have a conversation. I can actually be awake and be presence, be in the presence of my family and friends, and have a good conversation and not be so tired, So I found that's been really good for me.
Cool. So we've got a random guest question from Rosie for Pineapple. Hey, when are you going to come to Central Coast full time? Because your patients and co love you.
It's in the works. It's in the works, Rosie for Pineapple. It's in the works.
She's also saying on Instagram right now to open up the border so she can attend the DSD ones over in Miami.
Oh, that would be good. That would be sick. Yeah, we have a little Miami trip. Yeah, that'd be good. Yeah.
So I've also got a quick question for you, because I hear you're a food connoisseur, right?
Oh, yes.
What CPD course provided the best food and drinks, would you say?
Mate, there's so many. I did a Northern Cash App practice ownership course a few years ago at somewhere in the city, in Sydney. It was really nice food. It was buffet, but it was really nice. I just thought, I had my wife come in as well, and we thought, oh wow, this food's really good. Just everything, veggies, cakes, salmon. What's that? That's what I anyway. Everything for anyone. That was really good. I really liked that. So that was good. With the EODO, Derek has a nice bar upstairs in his Alexandria practice, and you can have some drinks and you can have some fancy tea if you like. He's got a chef there, so that's nice food there too. So that's a close second, I'd say. So there's some good ones, there's some average ones, but CPD is about food, right? It's not a good CPD if you don't have good food. You need good food.
That's right. And I had to come to you because you're the expert.
Yeah. Yeah, hit me up, guys. I'll tell you where the good food's at.
All right. Well, Dr. James Tran, thank you for coming on the show today. If you could let the people know how they can find you and basically what's kind of going on in your life.
Find me on Dr. James Tran on Instagram. Just shit posting really on Instagram. That's all I'm doing. And if you want to see my food journeys, James.Tran, that's my personal Instagram. But yeah, that's That's how you can find me. Hit me up.
2166 represent, eh?
2166, yeah. COVID hotspot. All right.
All right. Well, thank you everyone that's tuning in on LinkedIn, Twitch, Facebook, Instagram, and Twitter as well. Tune in again tomorrow for another episode with another exciting guest with Dr. Ziari. All right. Well, have a good night.
Good night, all.